and I'll have the Secretary have some closing remarks. Dr. Redfield?
Thank you, Mr. Vice President. I think it's important first for me to emphasize what you've heard already is that we're not defenseless against this virus. Mask works. Social distancing works. Hand washing works. Being smart about crowds, particularly indoor, works. It's strategic use, as Dr. Burke said, of testing to identify the silent epidemic, to identify the asymptomatic infection so that they can be pulled out of the transmission cycle works. Another point that I want to make is that we need to follow the data. We should be making data-driven decisions when we talk about what we're doing for institutions or what we're doing for commercial closures. For example, as was mentioned, last spring, CDC did not recommend school closures, nor did we recommend their closures today. I will say back in the spring, there was limited data. Today, there's extensive data that we have. We've gathered over the last 2 to 3 months to confirm that K through 12 schools can operate with face-to-face learning, and they can do it safely, and they can do it responsibly. The infections that we've identified in schools, when they've been evaluated, were not acquired in schools. They were actually acquired in the community and in the household. Today, as Dr. Burke said, our big threat for transmission is not the public square. It's small family gatherings where people become more comfortable. They remove their face mask and they get together, and it's this silent epidemic that begins to transmit. But it's not inter-school transmission. The truth is, for kids K through 12, one of the safest places they can be, from our perspective, is to remain in school. And it's really important that following the data, making sure we don't make emotional decisions about what to close and what not to close. And I'm here to say clearly the data strongly supports that K through 12 schools, as well as institutes of higher learning, really are not where we're having our challenges. And it would be counterproductive from my point of view, from a public health point of view, just in containing the epidemic, if there was an emotional response to say, let's close the schools. Finally, I wanted to echo what has been said by the Vice President and Dr. Fauci, is we are seeing the light at the end of the tunnel, where we are to now. And this is why now more than ever, as was said by Dr. Birx and Dr. Fauci and myself, now more than ever, we're asking all Americans to redouble their efforts, to be vigilant, to embrace masks, social distancing, hand washing, our advice about crowds, and really to support using the data to make decisions in their communities, particularly as relates to K through 12s and institutes of higher learning. These clearly, the data support that it's really important from a public health perspective, both from the pandemic as well as what you'll hear about in a minute, that these schools stay open. Finally, I just want to end on a clear message of confidence that I'm confident that we're going to emerge successful and bring this pandemic to an end. I don't have any doubt in that. But today, we need all of us to go all in. Go all in with face coverings, social distancing, hand washing, smartness about crowds, doing our part to help identify the silent epidemic. And I have confidence that at the end of the day, we're going to get a very achievable goal, which is to get this pandemic under control. Thank you, Mr. Vice President.
Thank you.